Aetna's built capabilities to turn piles of data into actionable clinical information that is helpful to patients and helpful to the care providers.
We are using technology to connect patients with our care coordination team.
That means that information must be stored electronically, available electronically, and available at all sites of the delivery system, regardless of where the patient happens to be.
We now have tools and systems and data in place to find out who's not getting their regular checkup, who needs to come in and see the physician.
The patient is very in the center of everything we do, very much so. The patient and how we connect that patient with the other providers is different than what has been done in the past.
Physicians work with team members, nurses, care managers, social workers to coordinate the care of the people that they serve.
Patients will realize that healthcare is part of their responsibility as well. And what they'll be able to do is have a team that they can participate with to keep themselves well.
There's great opportunities to be educated, to be engaged, and be empowered to take control of what you want for your health care.
I'm of the bias. Quality of care will improve at the same time we lower costs once we all have the same incentives.
We've got everything in place to be able to provide a higher level of care that's more efficient, more timely, where we are breaking down, hopefully, barriers to accessing care.
The right care at the right place at the right time.
The incentives to provide the most outstanding quality at the most affordable price.
Aetna stood out in a lot of categories. One that was an organization that was willing to understand the trust and the accountability that goes into a relationship.
Aetna was the most receptive, and they were also the most flexible in terms of not going in with a preconceived notion of this is how it needs to work.
We liked the people who lead Aetna. We trust them.
It's a new model of care and really is what I wanted to do when I graduated from medical school.
This is my chance to leave this industry better than I found it, and that's what motivates me every day.